The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It's a pleasure to have with us today Dr. Dahianna Lopez, Assistant Professor in the College of Nursing at the University of Rhode Island. Welcome, Dahianna.
Thank you for having me.
Yeah, our pleasure. So I know you've been doing some cutting edge work on injury prevention, from car crashes to drug overdoses and everything in between. Why don't you tell us a little bit about your work?
Sure. So my field of interest, as you said, is unintentional injury prevention. And when I say that to people, they ask if I'm a physical therapist. And although that would be great too, I actually go ahead and explain what injury actually is. And so disregarding COVID-19, right, unintentional injuries are the third leading cause of death in the U.S. So we often think about cancer and obesity. We think of all of those things that have a lot of television commercials and that sort of thing, but we never really talk about injuries. And so the fact that they're the third leading cause of death, they're incredibly important and yet understudied. So what are they? They're poisonings, motor vehicle crashes, falls, suicide, pretty much what you see in the news on a daily basis, even fires. Those are all unintentional injuries. And so overdoses and motor vehicle crashes are essentially what put unintentional injuries at the top of that list in the third spot. So while I was thinking about my research, I was thinking that there haven't really been any studies. I looked through the literature, and there's really not much out there about the overlap between overdoses and motor vehicles. We do talk about driving under the influence of drugs more generally in terms of research, but also in the news. But there is some new, there's new coverage that's looking at drivers that are being found inside of their cars, essentially overdose, and so they're unconscious. And either they have crashed a car or the car is just literally sitting in the middle of the road. And so this is something that I'm really interested in because there hasn't been any research, but also because I witnessed this happening at a local supermarket where I was leaving the store and there was a person in a car who looked blue, was not breathing, and there were people around the car. They couldn't get into the car, and we knew that we only had minutes to help this person. The ambulance came, they broke the window. I mean, it was very traumatic, and I'm so glad after they worked on this person for 20 minutes, I'm so glad that this person was revived because of life-saving naloxone. So that's sort of why I'm doing this research and why I find it important and interesting.
Sure, and a compelling story, and certainly an endorsement of the function and the role of EMTs, the wonderful work they do, emergency medicine, FDNY, or uh, generally speaking, in our society. So that's fascinating stuff. Let me ask you this. I mean, certainly in the popular press and in research, there has been a very significant increase in overdose deaths related to the opioid epidemic. Um, Talk a little bit about the intersection of that increase, what has led to that increase. Is that relevant to your looking at that intersection?
Yeah, so it is very relevant. One of the things that has led to the increase in overdose more recently is the switch to fentanyl, fentanyl-laced drugs. So fentanyl is a very, very powerful type of opioid. And usually this fentanyl, which originally was actually used in the hospitals, but now it's manufactured illicitly underground, and then it gets sold on the streets. Usually that was hospital grade, so it's very potent, but now on the streets, it can also be cut with, meaning there's drugs in the fentanyl that it can be heroin or other types of opiates. So these actually end up being very potent. And so people who use them, you have a high likelihood of overdose, and it's that potency that can be more likely, make people more likely to die. And it's relevant for my research because it means that if someone's using and does overdose, if they're in a motor vehicle that can essentially be traveling at fast speeds, that could put other people in danger, but it could also put the driver and the passengers in danger.
Sure. So one more epidemiology question. You've mentioned a couple of times that unintentional injury is a third leading cause of death. Give us a sense of what those numbers are and what's attributable to auto accidents generically and or drug overdose and or the intersection.
Sure. So I'll start off with motor vehicle crashes. So we have approximately 40 to 50,000 motor vehicle crashes in the United States, and they tend to occur actually in areas where there are large roads, and roads that do not have a lot of good urban planning. Deadly crashes will happen usually because someone is going at a really high speed. And so if we think about, say, for example, what would increase it? So during the pandemic is a great example. Some people were staying home, right? And other people had to go to work. So because of the congestion coming down, especially, so there's no more traffic or very little traffic, people actually go faster because they perceive it to be more empty. So they tend to drive faster, and that's essentially what leads to an increase in crashes.
Makes sense. So I could see your research taking a number of directions, whether in terms of prevention through policy change, intervention, working with EMTs and or other agencies that try to prevent drug use / overdose. What's sort of the end game of your program of research, if that's a fair question?
Sure. So I think the end game is to improve data, the data that gets collected in the field, but also how we track data across fields and how we bring together different types of data. So, for example, when a person goes and overdoses, not that they were intentionally doing that, but when that happens, multiple parties show up at the scene. So you have EMS, but you also have police. And some of those data sets actually don't generally talk to each other in the United States. Same thing with motor vehicle crashes. You have multiple people showing up to respond to these, and the data are not linked. So in the end, some of my research is looking at how do we work with different stakeholders, and how do we work together to improve the data that we collect so that we can learn more about this problem.
Sure. So it's kind of a systems approach of trying to coordinate services better so that there's better response and better prevention. Can you give me give me a concrete example. Like if you could have one birthday wish come true with respect to your research program that would in effect save lives, that brought systems together, what isn't happening that you'd want to see happen?
Yeah, so my birthday is actually in a couple of days. So what I would wish is well, first of all, we don't want people to overdose, right? But what I would want is for a response to be coordinated. So you have EMS, you have police on scene, and instead of necessarily blaming people, stigmatizing people for their drug use, that we can figure out a way to get people who need help to recovery services outside of the hospital setting instead of sending them to jail. Because recovering would actually be helpful with in terms of preventing the problem in the first place, which is driving under the influence of drugs. And beyond that, I mean, just really working together to use the data to inform policymakers and to create stories that are vivid, that matter, that connect with policymakers so that we do make different laws and changes at the systems level.
And with the final minute of this first half of our segment, how I'm always interested in knowing or curious in knowing how academicians that are doing such important work like yours get their messages to policymakers, legislators. In other words, this program hopefully does that a little bit, but how does one do that?
Yeah, so it's something that I thought about when I finished nursing school is how do you get messages out? And surprisingly, I started off by literally marching down to San Francisco City Hall and saying, I've done this research about pedestrian safety in San Francisco, and what can I do with this research? So sure enough, I actually ended up on the safety committee for pedestrians for the city councilors in San Francisco. And I learned all about how decisions are made. And as a nurse, I was able to use my voice and the data that I have to literally advocate within City Hall and work with different stakeholders in City Hall, but then also departments. So you work with engineers from the engineering department. You work with people who plan transportation systems. You work with people who build and design the roads. There are just so many people that you work with, and oftentimes it's just reaching out and forming a part of that policy circle, and something that I always encourage my students and also younger people to do.
That's great. That's a wonderful story. So let's just say that you and I together are charging all academics to go down to City Hall and advocate for their respective populations and to get their word out. I think that's brilliant. We're going to take a quick break. When we return, Dr. Lopez is going to tell us a little bit about her own life story, that wherein her varied and excellent college experience set the table for doing the great work that she's doing. This is Public Health America. I'm Dr. William Latimer. We'll be right back. Welcome back to Public Health America. I'm your host, Dr. William Latimer. We're here with Dr. Dahianna Lopez, Assistant Professor of the College of Nursing at the University of Rhode Island. Dahianna, I always open this segment with the same question. Where were you born and what were some of your formative experiences?
So I was actually born in Mexico City back in 1980s. And it was around the time that the economy in Mexico was literally about to crash. My mother, who was an economist, decided to move us to the United States. And so she had some connections. And so we were able to make it to Los Angeles. When we got to Los Angeles and my mother fell in love with someone who ended up not being all so great, we actually lost all of the money that we had saved. And so being in LA, we ended up going to different places to live. So we were housing insecure. By some definitions, you could say we were homeless. And we often lived in motels. We lived in the back of a print shop once. We lived in a car. There were so many places. I think my favorite one was living with one of my mom's newer boyfriends in the back of a cement factory. So my teachers would ask me, well, draw your house. And so I would draw this cement factory and they were like, what's going on? This doesn't make any sense. Meanwhile, my other, my friends were drawing these houses and apartment buildings. And so I grew up literally around machines, not really around a lot of children. And when I got to junior high school and high school, that was what changed for me. What changed was that I became a part of a magnet school that was focused on the arts. I was incredibly depressed at that time, so I used the arts to express myself. I surprisingly had green hair. I was a rocker, would wear black makeup, and I had teachers who didn't believe in me. But then I had a couple of other very, very special teachers, my chemistry teacher and my English teacher, and they believed that I could do something, that I was really intelligent. And so they helped me to graduate from high school. And then I had a college counselor. I was not going to apply to college. Okay, but I had not thought about that. This was not something that I thought about. But I had made it pretty far in high school. I was number 2 in my graduating class of 1,000. But I'd never thought about college. And so my college counselor said, well, you need to talk about this. Let's go ahead and apply. And I got help with applications because I didn't know how to write these essays. I didn't know where to submit things. And so eventually I made it to Berkeley, one of the top public schools in the country. And it was really tough. Being number 2 in my class, that was like, what happened before. All of a sudden, everyone was number 1 and 2 in their class, and so that was tough, right? To take the feedback of you're not that great. But I pulled through. Also had a lot of depression in college, which eventually I got treated, and I usually talk to my students about that. I'm not afraid to disclose that. So that's me through college.
What an extraordinary story, and an extraordinary story. And this word is so overused these days, but I'm going to use it anyway, of resilience and, truly beating the odds. I was part of a roundtable where a number of young people in the Bronx had talked about living in a car with their mom during COVID, by virtue of their mom losing a job. Obviously, that's not the exact same as your story, but it's saying that, and these were incredibly gifted young adults that were hopefully on their way to college. Again, I could think of no better time in Public Health America to make the point to our listening audience that a big part of the program here is to let folks know, young people and non-traditional age students, that everyone faces challenges, but if you're able to make it to college by hook or by crook, it'll help set the table for a profession as opposed to just a job. And clearly you've done that. Okay, I will get off my soapbox. So you make it to Berkeley, the number 1 ranked public institution in the United States of America. What was your major?
I majored in psychology.
Okay. And then, I noticed you have an MPH, if I'm not mistaken, and an RN and a PhD. So that's a pretty powerful combination. Just give us the rundown of the order. What happened when?
Yeah. So when I finished college, I actually wanted to go straight into a PhD in psychology, but my mother said, hold on a second, you got to live your life for a little bit before you make these big decisions. So I graduated and I moved back to LA and I got a job at UCLA. I was very lucky. And the job was taking people's blood pressure in a lab and collecting all the data. And in working with individuals and people in a hospital, it made me really interested in medical school. So I decided to do the master's in public health to kind of improve what I was learning about healthcare while I was in the hospital, but also to give myself some time to do the prereqs for medical school. But in doing that, I came across these really cool nursing researchers who were postdocs or assistant professors, and they taught me so much about public health and nursing. And so when they opened up a nursing program, I applied for it. It was tough to get in, and it was an accelerated 2-year master's degree.
Yep.
I think we hardly slept. So that was the nursing piece.
That's great. And was that at UCLA also?
That was also at UCLA, yes.
Yeah. So, the one take home of that also wonderful story. You should write a book about, the first third of your life. You can call you, and you don't have to credit me for that title. The point you made is so important, and that is you had exposure to postdocs and early career faculty that served, as I understand it, as role models of various paths you can take and did take. And I think the value of that cannot be overstated, because you get to see vistas that you wouldn't have otherwise imagined. I mean, prior to the pandemic, if you said to somebody, I'm an epidemiologist, the typical response I got is they thought I was a dentist. Not that there's anything wrong with that, but I mean, now by virtue of the pandemic, everybody knows what an epidemiologist is. All right.
Right.
So you do your RN, you do your MPH. You were thinking about med school. What were the decision? What's the decision tree to get the PhD?
Sure. So I still had a dream of getting a PhD, but it wasn't something that I was thinking about too much. I wanted a nursing job, but that was when we had the housing crash in 2008, 2009. And so there was a hiring freeze. And when I graduated, I did not have a nursing job. My classmates couldn't get a job for about 6 months. And so I needed work, right? I don't have the privilege to say, oh, I'll wait until a job becomes available. I needed to work, so I used my master's degree in public health, and I applied for a job at a hospital, University of California, San Francisco, doing research as a research nurse. Loved it, was in charge of using the data that trauma surgeons were collecting when they were treating gunshot wounds, when they were treating burns, when they were treating all those traumas. And my job was to use the data to work with policymakers and help them understand what were the resources that San Francisco needed at the time. It wasn't until I gave a talk in Boston that I even considered the PhD program, but it was like a dream, right? So I went down to Harvard School of Public Health. And I'm thinking, I'm standing there thinking, this would be a dream come true. This is amazing, but I'll never get in. And you know what? I'm not even going to apply. But I went in and I talked to a few people. It turns out that the next day they were going to be having an open house for prospective PhD students. I went, I talked very passionately about what I was doing, more focused on my work versus I'm going to give you compliments to see if I can get into this PhD program. And I actually ended up getting an email several months later to ask if they could fly me out to visit. And then the following year, I find myself starting a PhD program in health policy.
That's wonderful. That's great. And again, so many great take-home messages. Follow your dream. Don't don't limit oneself. And to say follow your dream is a bit hackneyed, but perhaps a better way to say it is, and again, now I sound like every grandparent who ever lived, at least the good ones. But be yourself. Like it just bring to the table what you bring to the table, and that will resonate to people, and that's clearly what happened. Not surprisingly, Dahianna, let me ask you this: you've already had an extraordinary career, and you're still, at the early stages of it, and you're doing some great work on injury prevention, which clearly is linked to some of the professional experiences that you've had. You've faced very real challenge throughout your life, and obviously faced it with grace and great intelligence. If you were to give one or two pieces of advice to our listeners of what to do to beat the odds, how to get to college and succeed, what would they be?
I think the first thing would be to say you are worthy, you are worth everything. Just because you don't have opportunities right then and there or at your school doesn't mean that they aren't out there. And it does sound cheesy to say dream. I see dreaming as so important because it helps you find opportunities. It helps you look for something that's outside of where you are right now. And the second piece I would say is to find your allies, to find people who are interested in helping you. Reach out to those teachers who are really nice, who have believed in your performance. Reach out to college counselors, and also reach out to friends, family members who believe in you and can help you look for new opportunities, and especially to help you apply for college. And I guarantee you, just getting yourself to college, that's the beginning, and it can change your life.
That's so great. I want to thank Dr. Dahianna Lopez. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America. Take care.